So to start, what are some of the common forms of anxiety that patients with cancer routinely go through?
Well, patients with cancer have lots of anxieties, and at initial diagnosis, at least 80%, if not more, have heightened anxiety about what the future is going to hold, what this means, what the treatment's going to be, how they're going to get through treatment, and if and how they'll come out on the other side. For most people, that actually really subsides within a month. But for about 20% of people, they continue to have heightened anxiety. And it's around any of those things, treatment-related side effects, how well the treatment's working, what their prognosis is going to be, and then lots of practical issues. How am I going to get to the cancer center to get my treatments? What's going to happen with work? Who's going to take care of my kids? Just about anything you could imagine. Very similar to how we've actually had to change our lives with COVID-19 now. Lots of little things in our lives have now become big things in our lives that we focus our attention on and may be anxious about, like how to get toilet paper.
So kind of with that being said, and you mentioned the coronavirus, does the stress and anxiety surrounding the coronavirus affect patients differently than, say, or patients with cancer differently than, say, someone who doesn't have cancer? And if so, how does it affect them?
Sure. Well, as you know, people with medical illnesses are at higher risk for worse outcomes with COVID. Many cancer patients, because of their treatments, have lowered immune systems. So this has really impacted our patients because they still need to come to the cancer center to get their treatments. If they're beyond treatment or on a treatment that's once every 3 weeks, they can stay away, and we're doing our check-in or our office visits by video. But if you need chemo or radiation, you have to come in. So anything we can do to mitigate their anxiety, to demonstrate that we're being as safe and cautious as possible with them really helps. But they're afraid to leave their house. For some, that's leading to a lot of loneliness. I mean, we're all to some extent afraid to leave our house, but they really don't want to be around other people. Interestingly, though, I've had a handful of patients that actually their anxiety is better. And I wonder if that's because a lot of things in our lives that we've had to focus on, like commuting, are no longer part of the picture. So it's been interesting to me that some patients actually are feeling a little bit better, maybe not having to deal with as much outside of their cancer and protecting themselves at home.
So with that being said, you said some patients feel that they're feeling better. How can that influence their health and their cares? And how can you maybe stress, let's build on this so when we do get out from the pandemic, you can keep this going?
That's a great question. I think, number one, trying to think about what's leading to having less anxiety. What are the things that are missing now where anxiety may have been heightened before and is not now? And how do we better cope with those issues or mitigate those issues or avoid those issues going forward, or at least during the cancer experience? I mean, many of us, if not all of us, have stresses in our lives that we just, have to, we can't avoid. So, for example, if you have to get your kids to school on your way to work and deal with traffic in the commute, especially here in Los Angeles, that's not going to go away once we go back to work. So how do we better cope with that reality? What things can we put in place to lower that stress? The flip side, and you asked about impact on health, is that anxiety in general for any of us, whether you have cancer or not, has negative consequences for our physical health. It lowers our immune system. It makes us more susceptible to illnesses. It worsens cancer care outcomes. Patients struggle to sometimes make important decisions because they're anxious, which can delay care and treatment or keep them from getting the treatment that they need.